Murray, and I want to thank you for calling this hearing, and I want to thank our witnesses for their testimony and for the expertise they bring to bear on this awful fentanyl crisis that has consumed the country. Pennsylvania is third in a category we don't want to be third in overdose deaths. Pennsylvania had 5,438 deaths in 2021 alone. That's one death every 2 hours. And of course, just like in so many other places, fentanyl is the dominant opioid. So it's consumed so many families, so many communities. Like Chair Murray, I'm very concerned about the rise in fentanyl-related overdose deaths in adolescents who, because of their stage of development, are more vulnerable to opioid use disorder. This is particularly the case when a young person has a mental health condition like ADHD, depression, or anxiety, which too often goes undiagnosed and untreated. So I'll start with Dr. Delphin Rittman. Can you speak to two things? Number one, the relationship between opioid use disorder and other mental health conditions. And number two, how timely mental health care for young people can help prevent opioid misuse.
Yes, thank you for that question, Senator, and for all of your work and advocacy in this area. We know that for some youth as well as adults, use of opioids or other substances is connected to, for some individuals, mental health challenges. And so to the extent that services and supports are, and we talk a lot about this, that we're able to take a co-occurring approach, that services and supports are able to address both mental health and substance use challenges. But that's important also in terms of identification. We do have a program called, for short, it's the Youth Family Tree. And what that program is about is early identification of youth that may be struggling, youth as well as transition age individuals and other members of families. It's a grant that takes a community-based approach, a family-based approach, and really uses multi-system approach to be able to identify, do early identification, but also early connection to services and supports such that the addiction doesn't progress. And so I think that's one area that is an important area of work. In fact, that grant is up for authorization, so certainly appreciate this committee's commitment to that area of work. There's also work in terms of, being able to ensure access. You'd mentioned the piece around ensuring that there's timely access to services and supports. And so I think that's an important part of the system of care work as well. Ensuring that whether it's a school system or whether family members, that there's awareness around how to access and connect students or families to services and supports.
Thanks very much, Doctor. And I wanted to turn to Carol Johnson, with whom I worked on the Aging Committee. It's great to see you again, I guess twice in a week. But Carol, I wanted to make reference to both screening and access to medications for opioid use disorder, which of course are not yet meeting demand. And we know there are wide gaps in the workforce that are caring for adolescents. I have a bill with Senator Cassidy to support cross-training of the pediatric healthcare workforce to address mental health and substance use disorders. Given the serious threat of fentanyl to young people, we can't afford to miss any opportunity to screen adolescents for these disorders. How do we increase opioid use disorder competency in the pediatric healthcare workforce?
Thank you so much, Senator Casey, and thank you for your leadership on this issue. We think this is critically important, making sure that we create sort of norms and standards in the healthcare workforce, that primary care sites, pediatrics offices, primary care physicians, our community health centers are places where our clinical workforce is trained to identify mental health and substance use disorders, and where appropriate, be able to help begin treatment. And so that's why we're committed to this work. We appreciate the progress that we've made with the Pediatric Mental Health Access Program, which has helped us be able to bring mental health expertise directly into pediatricians' offices, but we want to continue to look for ways to grow the capacity of the primary care workforce and pediatricians to address substance use disorder directly.